Hello, my name is Yvonne. Today I will be talking about the medication named Denosumab, a brand name for Prolia. I will discuss the medication indication, common side effects, some important patient counseling points, background information for Prolia, lastly, warning and precaution while taking this medication. First, let's talk about the indication. What is this medication for? Prolia is indicated for the treatment of postmenopausal women with osteoporosis at high risk for fracture. High risk is defined as a history of osteoporotic fracture, multiple risk factor for fractures, or patients who have failed or are intolerant to other available osteoporosis therapy. Prolia is also indicated for treatments to increase bone mass in men with osteoporosis at high risk for fracture. Prolia is also indicated for the treatment of glucocorticoid-induced osteoporosis in men and women at high risk for fracture who are either initiating or continuing systemic glucocorticoid daily dose equivalent to 7.5 milligrams or greater of prednisone and expected to remain on glucocorticoid for at least 6 months. This medication can be used as treatment to increase bone mass in men and at high risk for fracture who is receiving androgen deprivation therapy for non-metastatic prostate cancer. Lastly, Prolia can be used to be a treatment to increase bone mass in women at high risk for fracture who are also receiving adjuvant aromatase inhibitor therapy for breast cancer. Now let's talk about the most common side effect for people who are receiving Prolia as the therapy for osteoporosis. The most common side effects are including back and joint pain, pain in the arms and legs, high cholesterol, muscle pain, high blood pressure, bronchitis, especially for those who are glucocorticoid-induced osteoporosis, bladder infection, especially for menopausal women. How will the patient receive Prolia? Prolia is subcutaneous injection that will be given by a healthcare professional. It is typically received one time every 6 months. Patients should also be on calcium and vitamin D as directed while on receiving Prolia. If the patient happens to miss a dose of Prolia, they should receive the injection as soon as they can. Take good care of the teeth and gum health while the patient is receiving Prolia. Brush and floss the teeth regularly. And make sure to tell the dentist when the patient is on Prolia before any dental work is done. When should the patient contact their doctor? First, if the patient becomes pregnant while taking Prolia, the doctor should be notified. And also if the patient experiences the following symptoms that does not go away or get worse: blistering, crusting, irritation, itching or reddening of the skin, cracking, drying or scaly skin, or rash or swollen skin that does not go away or getting worse. Now let's talk about the background information about Prolia. Denosumab is a IgG2 monoclonal antibody with affinity for nuclear factor kappa ligand, RANKL. It binds to RANKL, blocks the interaction between RANKL and RANK, which prevent the osteoclast formation, leading to decreased bone resorption and increased bone mass in osteoporosis. The dosage for Denosumab Prolia is subcutaneous injection every 6 months. If a dose is missed and administered as soon as possible, fracture risk may increase if the dose does not administer within 7 months of prior dose. If fracture risk remains high after 5 to 10 years of therapy, consider extending therapy or switching to alternative therapy, such as bisphosphonate. Discontinuation or interruption of Denosumab should not occur without subsequent alternative therapy. Now let's talk about the warning and precaution to patients that's on Prolia. Denosumab inhibits osteoclast bone reabsorption, which causes an imbalance of osteoclast and osteoblast activity, reducing the amount of skeletal calcium released into the circulation. Therefore, patients who are on Prolia are at risk for hypocalcemia. Another warning for patients that's on Denosumab is infections. Denosumab inhibits RANKL, which can be found on cells of the immune system, including activated T lymphocytes, B cells, dendritic cells, and monocyte macrophages. Therefore, RANKL inhibition may alter the immune system. Another warning for patients that is on Prolia is osteonecrosis of the jaw. Denosumab may suppress the bone turnover or remodeling, which can result in inhibition of blood supply, constant microtrauma, and infection or inflammation. Patient who is receiving Denosumab is characterized by non-healing or exposed necrotic bone in the jaw region. And that concludes today's presentation. Thank you.